after we studied about the actions of the muscles in the medial compartment of the thigh, let us discuss in detail about the origin, course as well as the innervations of obturator nerve. So before I continue with the obturator nerve, let's have a review of the lumbar plexus again with anterior as well as posterior divisions. So if you see the lumbar plexus from L1, L2, L3, L4 and L5. Okay, let us see, this is the anterior division and towards this is the posterior division. So all the nerves which arises towards anterior are called as the anterior division, and from here we can consider it as a posterior division, right? So the L1 gives rise to two nerves, or I can draw this also like this. L1 gives rise to two nerves, which means the anterior divisions of the L1, that is ilio-inguinal and ilio-hypogastric. Okay, if you see from L1, L2, L3, L4, L5, L1 is giving rise to ilio-inguinal and ilio-hypogastric through its anterior divisions. So if you see the L2, L3 as well as L4, L2, L3, L4 combine to form obturator nerve. L2, L3, L4 combine to form obturator nerve, that is the anterior divisions, right? The anterior primary ramen, that is anterior divisions of L2, L3, L4 from the lumbar plexus joins to form the obturator nerve. And from the same L2, L3, L4, if you see, from the same L2, L3, L4, if you see here, so L2, L3, L4 from posterior division, it gives anterior, it is the obturator nerve, and posteriorly femoral nerve. Okay, so the root value of the femoral as well as obturator nerve is the same. Both are arising from the L2, L3, L4 segments only, but one is the anterior division and other is the posterior division. That's why we can say the obturator nerve is the chief nerve of the medial compartment of the thigh, where it is the branch of lumbar plexus, and it is formed by the ventral rami, that is anterior primary rami of spinal nerves L2, L3 as well as L4. So sometimes what happens, L3 as well as L4, from L3 as well as L4, L3 and L4, that is towards anterior division, join to form accessory obturator nerve. Join to form accessory obturator nerve. Okay, and here if you see the L1 as well as L2, from L1 as well as L2, it forms genitofemoral nerve. Genitofemoral nerve. So from L1 as well as L2, it is giving rise to anteriorly genitofemoral nerve. So like this, overall, even though there are other branches are there, but our main concentration here is towards the obturator nerve. To get an idea, I showed you the lumbar plexus and its associated nerves. So that's why we can say that the obturator nerve origin is from lumbar plexus, from the anterior primary ramus of L2, L3 and L4. If you see the course of this obturator nerve, the upper part of the nerve mainly lies in the pelvis the upper part of the nerve mainly lies in the pelvis, and it enters the thigh by passing through the obturator canal. It enters the thigh by passing through the obturator canal. So let us consider that this is the superior ramus of pubis. This is the superior ramus of the pubis. Okay. So here, through the obturator canal, the obturator nerve through the obturator canal is entering in the thigh. So where immediately after it leaves the canal, it divides into anterior as well as posterior divisions. Immediately after it leaves the canal, that is exactly behind the superior ramus of the pubis, it divides into anterior as well as posterior divisions. So first I will draw, this is the anterior divisions. So this is the muscle of obturator externus. This is the muscle of obturator externus muscle. So here it is dividing into anterior as well as posterior divisions. So this is the posterior division and this is the anterior division here. See carefully. So remember, immediately after it enters into the thigh, the anterior division of the obturator nerve is separated by the posterior division of the obturator nerve by the few fibers of obturator externus muscle. So what is this muscle? This is the obturator externus muscle. I will repeat here. It is formed from the anterior primary ramus, that is from the ventral division of the lumbar plexus, L2, L3 and L4. The upper part of this nerve lies in the pelvis and it enters into the thigh by passing through the obturator canal. Immediately after it passes down through the obturator canal at the posterior aspect of the superior ramus of the pubis, it divides into anterior as well as posterior divisions. The posterior division, you can see clearly here, pierces through the uppermost fibers of the obturator externus. You can see here the posterior fibers are piercing toward the uppermost fibers of the obturator externus. The anterior division is separated from the posterior division by the few fibers of the obturator externus here. Okay. So after it passes, after it forms the anterior as well as posterior division, now let us just discuss about the anterior division as well as posterior division separately. Okay. So now I will show you about the anterior division. Let us discuss about the anterior division first. Anterior division passes downwards. Anterior division passes downwards in front of, this is the anterior, this is the posterior, right? Because this is the gluteus maximus muscle. So this is the posterior aspect, hip area. So this is the anterior division of the obturator nerve. The anterior division of the obturator nerve passes in front of the obturator externus, right? And it continues downwards, and it continues downwards behind, it continues downwards behind gracilis. It continues downwards, sorry, this is the pectineus, it continues downwards behind the pectineus as well as adductor longus. It continues downwards behind the pectineus as well as adductor longus. You can see here how the anterior division is passing behind the pectineus and behind the adductor longus and in front of adductor brevis, right? I'll repeat here. Immediately after it divides into anterior as well as posterior divisions, the anterior division passes in front of the obturator externus and continues downwards to continue downwards to pass behind pectineus and adductor longus and in front of adductor brevis. Okay, and after it forms here, it finally terminates by supplying the fibers to the femoral artery. So here the anterior division gives innervation to the pectineus, it gives innervation to the adductor longus. Remember, adductor brevis we studied, it may or may not innervates the adductor brevis, and it also supplies the gracilis, right? So this is the nerve supply, this is the innervation of the anterior division. Okay, so it is giving pectineus, adductor longus, gracilis as well as adductor brevis. Means adductor brevis if it is innervated by the anterior division, right? Next we will see about the posterior division. So the posterior division enters the thigh by piercing the upper border of the obturator externus muscle. So after it pierces from the upper border of the upper fibers of the obturator externus, if you see here, it passes between or it passes behind the adductor brevis and in front of adductor magnus. Behind adductor brevis as well as in front of adductor magnus. So while passing through this, remember we already studied the anterior fibers of the adductor magnus as well as posterior fibers of the uppermost fibers and lowermost fibers. So the uppermost fibers of the adductor magnus is innervated by the posterior division, and the posterior division may also gives innervation to the adductor brevis if it is not innervated by the anterior division. So this is the posterior division here. So posterior division enters into the thigh by passing or by piercing the uppermost fibers of the obturator externus. It passes downwards behind adductor brevis in front of adductor magnus, where it supplies the adductor part of the adductor magnus and it gives innervation to the adductor brevis if it is not supplied by the anterior division, and it also gives innervation to the obturator externus. It also gives innervation to the obturator externus. So this fibers ends by supplying popliteal artery. The anterior division ends by giving innervation to the femoral artery. Now you understood the course as well as how it divides into anterior as well as posterior divisions and what is the innervations of the obturator nerve in detail. For example, if you see the clinical anatomy of this obturator nerve, in some intractable cases there will be a spasm of the adductor of the thigh, like in some intractable cases of spastic paraplegia. So whenever there is a spasticity of these muscles because of the intractable cases of spastic paraplegia, so this spasticity can be relieved by the section of the nerve, right, or by the surgical division of the obturator nerve. Another important point I want to tell you that the anterior division also supplies to the hip joint, gives innervation to the hip joint. That is the reason if there is any disease of the hip joint, the pain may be referred towards the knee as well as towards the medial aspect of the thigh, because the knee as well as the medial aspect of the thigh is innervated by the same nerve. So that is the reason in the disease of the hip joint there may be a referred pain in the knee as well as the medial aspect of the thigh because of the same innervation by the obturator nerve. Okay. So after this we have to see about another nerve called as accessory obturator nerve, right? So I told you, even though the accessory obturator nerve is not seen in all the cases. Only in 30% of the individual we can see this accessory obturator nerve, right? So if you see accessory obturator nerve, so how it is formed? Accessory obturator nerve is formed by the anterior primary rami of L3 as well as L4. So I will draw accessory obturator nerve over here. Let us think this is the accessory obturator nerve from L3 as well as L4, anterior primary rami of L3 and L4. So here it passes through the psoas major and in front of the superior ramus of the pubis. Psoas major and superior ramus of the pubis. So after passing here, it passes behind the pectineus muscle. Here you can see it passes between the psoas major as well as the superior ramus of the pubis, or sometimes it passes through the psoas major, and after that it passes behind the pectineus. And behind the pectineus it divides into three branches. One branch may supply the hip joint, one branch may innervate the pectineus, and another branch communicates with the anterior division of the obturator nerve. What it is? One branch innervates the hip joint, one branch innervates the pectineus, and one finally communicates with the anterior division of the obturator nerve. Sometimes what happens, the accessory obturator nerve may be very small, right? So because of it is very small, so instead of it is dividing into three branches, sometimes it ends up by supplying or by piercing the pectineus only, right? So this is about the nerve supply of the medial compartment of the thigh, where we studied about the obturator nerve as well as accessory obturator nerve. Continuing our discussion in the medial compartment of the thigh, now we have to discuss about the blood supply in this region. As I already mentioned you that there are two arteries we have to study in this compartment. One is the obturator artery and second one is the medial circumflex femoral artery. Okay, so let us first discuss about the obturator artery. Obturator artery. Okay, so here the obturator artery is a branch of internal iliac artery. As you know that in the pelvis there is a common iliac artery. So let us consider this is a common iliac artery. The common iliac artery gives rise to external iliac as well as internal iliac artery. So let us consider this is the internal iliac artery. So this is the external iliac artery. So the external iliac artery continues as a femoral artery, that is behind the inguinal ligaments, right? Behind the inguinal ligaments it continues as a femoral artery. So the main or the chief blood supply of the external iliac artery is towards the lower limb, towards the thigh region, mainly continuing as a femoral artery, tibial artery, popliteal artery, like this it continues and supplies the lower limb. But if you see the internal iliac artery mainly gives off the blood supply to the structures which are present in the pelvis. So like this internal iliac artery has many more branches like gluteal arteries, sacral arteries, so like that pudendal artery, like that there are many arteries which are coming from this internal iliac artery. But in the medial compartment of the thigh we are going to discuss only about the obturator artery. So this internal iliac artery, now we are going to discuss a branch of the internal iliac artery. Let us consider this is the branch of the internal iliac artery called as obturator artery. So this obturator artery, after it arises from the internal iliac artery, reaches the superior margin of the obturator foramen. Let us consider this is the obturator foramen. So it reaches the superior margin of obturator foramen. So here the obturator foramen is covered by the obturator membrane. So this obturator artery divides into two, that is gives off two divisions. One is the anterior division and another one is the posterior division, which is also called as the medial as well as lateral division. What it is? Immediately after the obturator artery arises from the internal iliac artery in the pelvis, it reaches the superior margin of the obturator foramen, where it divides into anterior and posterior divisions, also known as the medial and lateral divisions. So this encircles the obturator foramen, means it encircles the obturator membrane. So it totally, the anterior division as well as posterior division mainly encircles the obturator foramen. After that, where it gives anastomosis, with the medial circumflex femoral artery. After it encircles the obturator membrane, that is towards the obturator foramen, it finally anastomoses with the medial circumflex femoral artery. So here both of the arteries, both of the divisions of the artery, that is anterior division as well as posterior division, supplies the neighboring muscles which are located nearby that region. And also an extra point I want to say here, that the posterior division also gives us a branch to the acetabulum called as acetabular branch. Mainly this branch runs towards the acetabular notch. What it is? The posterior division of the obturator artery also gives off a branch to the acetabulum called as acetabular artery. This acetabular artery, which is a branch of posterior division of obturator artery, runs towards the acetabular notch and the acetabular fossa, where it mainly gives blood supply to the fat which is present in the acetabular fossa. Not only that, in that region it also sends a twig to the head of the femur and along the round ligament. So this is the blood supply of posterior division of acetabular artery. Okay, so mainly which is supplying the acetabular fossa. In the acetabular fossa, the fat is supplied by the acetabular artery, which is a branch of posterior division of the obturator artery, and after supplying the fat which is present in the acetabular fossa, it also sends a twig along with the round ligament, right? So this is what we discussed about the obturator artery. So another artery we have to discuss in the medial compartment of the thigh is the medial circumflex femoral artery. So here our next artery will be medial circumflex femoral artery. Okay, medial circumflex femoral artery. Right, this is the medial circumflex femoral artery. So here the medial circumflex femoral artery is a branch of the profunda femoris artery. You know, profunda femoris artery is the largest branch of the femoral artery. So let us see the femoral triangle here. You know that the femoral triangle is formed by the sartorius as well as adductor magnus muscle as well as inguinal ligament. right? Inguinal ligament. Here you can see the femoral vein, and here you can see the femoral artery, right? So, as I told you that the medial circumflex femoral artery is a branch of profunda femoris artery, or frequently this medial circumflex femoral artery arises from the femoral artery itself. So I will show you here. So in the femoral triangle, if you see, this is the femoral artery. In the femoral triangle, it may arise from the profunda femoris artery, or let us consider it is arising. It may arise directly from the femoral artery. This is the medial circumflex femoral artery. So it is arising from the femoral artery itself, or it may arise from the profunda femoris artery, which is the largest branch of the femoral artery. If you see this, the course of the medial circumflex femoral artery, it leaves the femoral triangle. After it leaves the femoral triangle, it runs between the psoas major and pectineus. Right? You can see here the artery runs between psoas major and pectineus, and it continues its course. The artery continues its course towards the gluteal region, and while it is continuing its course towards the gluteal region, the artery runs between, what is this? Obturator externus, and this is the adductor brevis. The artery runs between the obturator externus and the adductor brevis. And finally, the artery reaches the gluteal region. Here you can see, finally the artery reaches the gluteal region between the two muscles. So from here, after it passes between the obturator externus as well as adductor brevis, it reaches the gluteal region. In the gluteal region, it is present between quadratus femoris. This muscle is called as the quadratus femoris and adductor magnus. So in the gluteal region, it is related to the, which means it is present in between the quadratus femoris and adductor magnus, where it terminates by giving ascending as well as transverse branches, where the artery, medial circumflex femoral artery, ends by, or it finally terminates into two branches by dividing into ascending as well as transverse branches. So they are called as the terminal branches of the medial circumflex femoral artery. So here, before they give terminal branches, the artery gives off many muscular branches. For example, the artery may give a branch to the adductor brevis, give branch to the obturator externus, and it gives a branch to the pectineus, like that. So before the artery terminates into ascending as well as transverse branches, it is giving rise to many muscular branches from where it is passing through. So not only that, while it is passing from the femoral triangle, and towards the or between the psoas major and pectineus, it also gives off a branch to the acetabulum called as acetabular branch. As we studied in the obturator artery, we studied about the posterior division of the obturator artery. The posterior division of the obturator artery is also giving a branch to the acetabulum, where it gives blood supply to the fat which is present in the acetabular fossa. So like that, if you see the medial circumflex femoral artery, after it leaves the femoral triangle, after it passes between the psoas major and pectineus, it also gives off a branch to the acetabulum, So this acetabular branch of the medial circumflex femoral artery also supplies the fat in the acetabular fossa. So it also sends a twig to the head of the femur along the round ligament. Okay. So these are the two arteries we have to study. We studied about in the medial compartment of the thigh.